all I'm going to say about myself.
Sorry.
Okay, continue. Is that one of my institutional bases has been Deakin University for many years, where I've been involved in working in many countries in the world from there, but also in teaching community development, which over the last probably 15 years I wasn't doing because I was running a research centre there on citizenship and human rights. I have been interested in the question of community development in crisis, in times of crisis. There's another agenda there, which is community development in crisis. I don't think it is, but that's a whole other issue. And why are communities and community development practices and processes so often ignored? When I started looking at this, there's so little literature. We've got, at any one stage, we've got thousands of crises around the world, and there's so little literature on, first of all, what communities are actually doing, and secondly, where are the community development practices in there, which for us in community development just seems so obvious, and yet they're being ignored. And there are two, I suppose, case studies that I just want to go through really briefly with you today. The first one is Aceh in the aftermath of the tsunami in December 2004. I also thought of and was going to look at bushfires in Australia because we've got brilliant examples of community development there, but decided that there's a much more immediate problem at the moment. It's still always there, of course, the bushfire issue, but what's happening under the COVID-19 pandemic. So this is just happening, it's still unfolding, but I just want to raise some of the issues there. Start on Aceh. I was working with friends and colleagues for several years on mapping Islamic and Islamist organisations in Indonesia. I was working with the Wahid Institute in Jakarta. We're working on December the 26th, all that month. A lot of people have been down in Melbourne. That morning we heard that there'd been a tsunami. My friends and colleagues scrambled to get a flight up to Jakarta as soon as they could. We discussed what my position might be. I was very conscious at that stage of two things. One was the whole disaster tourism industry that was developing, and particularly a lot of media people and, of course, politicians, photo opportunity. But the other one was, of course, we're seeing the beginning of the decolonisation agenda. We didn't use the term then, but that's what we were talking about. So it was decided that my friends and colleagues they went to Jakarta, and then whatever way they could, they got up to Banda Aceh, which is the capital of Aceh. Then they would get back in touch with me about whether, and as I said to them, whether there's any point, whether I'm just going to be a nuisance if I go up there, or is there anything that as a friend rather than as an aid worker I could do to help. They got in touch with me and said, yes, there's a lot of very urgent things. We can't go through the formal institutional basis to get these, takes too long to get the Indonesian government, takes even longer to get international aid organisations to see what we need. This is the people I knew with the survivors who were their friends and relatives, what we need immediately. And what they came back with was that we need, talking to people, the crucial thing is what people wanted was to get back to normal, knowing, of course, they could never get back to exactly where they were, but they were looking at getting schools up and running. They were looking at getting kids, dealing with kids and offering something that would give some normality. Now, it came as a surprise, but this is exactly what they wanted. And I found out when I arrived, this again was what they wanted. They wanted toys, boxes and boxes and boxes of toys. And so I managed to pull together some money from various places, from friends here, but there's no formal organisation in getting the money. And I did get boxes and boxes of toys, mainly cuddly toys because they were lighter and cheaper to carry. And on my way up there, could I pick up boxes and boxes of school books because they were trying to get the schools up and running. So I got there and the number of things hit me. And I'll just go through a couple of the things that hit me. First thing is just the airport had been open, just driving out of the airport. I saw all these bulldozers and I thought, well, maybe they're beginning to start rebuilding as I saw them in the distance. They'd brought the bulldozers in from the hinterland because everything, I should say, the waves were up to 30 metres and above. They affected the coastline of the northernmost province of Indonesia, which was Aceh, more than 700 kilometres. Where the waves came in, quite a few kilometres going in till they hit where there were hills, they hit the hills. They at least 130,000 people that morning lost their lives. And there's a picture there that the villages and the towns and the capital Banda Aceh, where the wave got into and Banda Aceh were destroyed. There were dead bodies everywhere. And what I found was that, of course, what they were doing, because this is what they decided, the survivors had taken control and they had decided that they'd pick up the bodies and they'd bury them in these mass graves. So there's no nice closure. There were no grief counselling. People didn't know where, how, and when their relatives and friends died. They didn't know where they were buried, but they decided that fighting the disease, particularly the threat of cholera, was the most important thing. So the survivors actually took control early on. They provided food. They set up postcodes, little places that people could go to find out where their relatives were, if they were still alive, etc. They organised accommodation. Many people decided they wanted to build humpies on their block of land. They knew where their land was because they knew they had, for example, a blue tile at their front door and there was a tile or whatever. But some went with relatives who had places up in the hills, and some decided that they'd just build their humpies back on the ground that they believed was theirs. Then as time went, so that was the emergency relief. The agencies, international and Indonesian UN agencies came in, they commandeered, we saw, and with lots of comments from my friends, that they commandeered the big houses that had survived, mainly a lot of them in the hinterland. The first thing they did was put up a boom gate, put a guard box, and I don't know I asked people, what were they doing early on? Well, they were trying to find out what was needed. They asked people, but in many cases, they actually ignored what people said. So the upshot of it, over the period of the first lots of months, that they built the wrong accommodation. They did things that they thought the people wanted rather than listening to what, even though they might have played lip service to listening. One group I was particularly involved in, I'm watching the time, was a group called Forum Bangun Aceh, and there's a website, I meant to put it there, where you can get more information on. They were Achenese, and they went out to their villages and to the neighbourhoods and said, okay, what do you need? What do you want? And again, what came through the message is we want to get the education system, whatever you can do. We want schools. They got teachers in from all over Indonesia. We want that up and running, but we also want to get our livelihoods back. So then the people at Forum Bangun Aceh asked what it was they needed to get their livelihood back, and what they said was, well, in our village we were rice farmers, so we want rice plants. We need rice plants to get that back. This family was running a becak, a little motorised scooter. We want that as a taxi back. We want to set up a warung, a store by the road, so that we could start cooking. We needed some basic ingredients and we needed pots and pans. So this group then said, well, people who said this is what we need to get things going. And they then said, well, one way of doing it is that we can help you to access these. At this stage, these groups that were loose, informal groups started to get a more formal structure, and they began to be called NGOs, local NGOs. And they then negotiated over in Medan, which was on the other side of Sumatra. to get the betjaks and to bring them in. And slowly they started to supply villages and farmers and people who were in the suburbs with what they needed to get their livelihoods back. And over the period of the first few years, they actually managed to get thousands and thousands of people get their livelihoods back. And the way in which they did it was having got money from each other and from their friends and from some people internationally, actually. They started to get loans, and they called them revolving loans, because each time a family got its back on its feet, or a village, they gave the money back. And so these revolving loans, rather than paying any interest or going to banks or anything, at one stage a bank did approach them, but they looked at, there was a microcredit program, and they looked at all the holes with that and didn't do that. So that's how, in this instance, one NGO decided that as Archinese, for Archinese, with Archinese, how they would redevelop or reconstruct Aceh. I can give lots of other examples, but I'm very conscious of time. So what were the elements of CD in the developments that I saw? And again, other people will have different views. They will have seen different things. So I'm just saying these are my experiences from both being there and also from interviewing both large NGOs. I went to AusAid, to the UN offices, etc., as well as working closely with Forum Bang and Aceh. And that was that, from the point of view of Forum Bang and Aceh, community control was the absolute starting point, asset-based. People had the wisdom and the skills. What they wanted and what they asked them is, what do you need? And they said, we want things to get our livelihoods back. So there was no question, as some of the big INGOs were doing, of taking them out and giving them capacity building classes. And in some of those capacity building sessions, they'd be teaching them how to write submissions for funds, so that when they had passed these courses, they could then go and write submissions to the agencies. In the meantime, the small NGOs, of course, up and running, and were the immediacy of the need was there, and they'd actually got things going. They asked people what they needed, and they did it genuinely. They used CD facilitators. They didn't call them, I've forgotten what the word is in Indonesian, but they used what I would call CD facilitators to help them. For instance, many of the people knew how to do basic bookkeeping, but they wanted, it wasn't that they forced this on, they wanted to know more about how they might sort of get something like a very basic business plan. And of course, the principle of mutuality came through with their concept of revolving loans. So I saw that, and I also saw the other side, what was going on with the big international NGOs and the Indonesian NGOs as well. So what are the challenges that out of this? So first of all, was when I spoke to people at the big NGOs, they still worked in a deficit framework. They still worked with the idea of the survivors being victims. And this was helped along by the media reports. I mean, I was horrified to look at Western media reports where they completely left out what local people were doing and how they'd taken control. Then, of course, there's the politics of crisis, the claim that they needed strong leaders, that the victims were not able to look after themselves, but also as a photo opportunity. And we get that always in crisis, whether it's our Prime Minister here or it was Bill Clinton who flew into Aceh. There's a whole politics behind this. And of course, there's also disaster capitalism, as pointed out by Naomi Klein. And what, of course, we need in all of this is the need for decolonisation of aid, particularly of humanitarian aid. And the other thing is, some people I spoke to, some Archinese, just chose not to be involved, and that's their choice. So you can't say you must be involved in CD when their choice is, well, we don't want to be involved. Now, I'm running out of time, I know. The second one is our pandemic. What I've tried to do is pick up what's going on to make sense of all the contradictory things that we're seeing. And I've identified 4 narratives: the narratives of fear. We don't know where the virus is coming from. We don't know who's got it. And the suspicion of foreigners being, or strangers, I should say, the whole securitization agenda, which has been used so cleverly, I suppose, by people in power. Overcoming this is the solidarity, and this is where people going and helping each other. But the solidarity is circumscribed by the terms of reference in which people can go and help by giving help to their neighbours or dropping a note. The one that's scaring me is the authoritarian narrative, which is the acceptance of the power of the people in control to tell us what to do. Now, the problem we've got with that is if we arc up about that, we then are called libertarians. And the libertarianism has got to, particularly, of course, from the point of view of community, it's got a really, and correctly so, has a really bad press. I mean, that's one of the worst things you can be called is a libertarian, unless you are a libertarian. But that also means that you've got the criticism of the conspiracy theories, which many of the libertarians are using. So you've got all of those things. Many of them contradictory. The fear thing is so strong, particularly, and I should say this is talking from Victoria and talking from Wurundjeri country in Melbourne at the moment. And this fear is just permeating the whole of Melbourne. People are very, very obedient.
5 minutes.
God. Okay. All right. So what are some of the types of citizenship? And sorry, let's go back. Trying to make sense of what people are doing in communities. I've been struggling with trying to find a concept that will allow for all the different varieties of community responses. And so I've just got a list here, which are protest, taking control, which we do have. Where I spend a lot of time in Western Victoria in Colac, there was an outbreak and the local people actually took control of what should be done and how they should do it. We've got Indigenous communities, particularly in remote Australia, who've taken over. So we do have examples of community development at work, but the vast majority of community action, active citizenship, although it involves active and taking initiative, it's within terms of reference that are already set. We've got the whole thing about solidarity and support with the appalling North Melbourne, Flemington public housing lockdowns, which I can send some references on, but it was appalling. There were delivery of food and medicines. The Sikh community, for example, was involved in this. The Asylum Seeker Resource Centre. So you did get people coming in, but it was at the other end of the scale of community development. A complete, they did a policing thing with stopping people from even going out of their rooms. But you did get people coming in and helping. You also got initiative coming where people went and knocked on people's doors, the neighbourliness, and this is still autonomous action, but you've got large amount of the so-called active citizenship it involves some sort of taking initiative, but they're supportive roles within a state framework. It's not in any way taking control. It's actually working to provide service delivery and welfare. And just to come up to the final thing, the challenges for CD are practicing community development in the context of confusion, fear, authoritarianism, and the conspiracy theories. And the questions I end up with are, have we accepted a regime of community powerlessness? Because there's so little where the community has, or in many ways people would say is able to take control. Community development requires information and a sense of urgency. How do we develop these and undertake community development roles? And one of the things I think we should begin to be doing is telling stories of where the CD practices are at work during the pandemic. I was talking talking to friends, last night I was talking to friends around Australia, and of course it hit me. We are so COVID-19 sensitive in Melbourne. I speak to people who say, what crisis? You know, they believe they haven't been touched by the crisis. And they say, well, we can't understand what you're talking about with crisis. We haven't had any of these things. So this then comes down to the lack of solidarity. And I'm not being critical of it because it's a perfectly responsible or perfectly normal response, even though, of course, we've also got a breakdown in their neighbours, and there's no community solidarity there. So it's a really difficult, complex situation. It's still unfolding, but I suppose I think we should be thinking about some of the questions about the role of community development. And why? Because I believe that community development is really important in times of crisis. Now, hopefully I've got that in the 20 minutes.
Absolutely spot on 20 minutes. Unbelievable, Sue. Well done. All right, I'll just stop this recording. Yep.